What he said was, ego is the death of life.
Yes.
And death of ego is life.
It's not just about connecting. You want to share not just the sadness, but you want to be a part of that happiness.
Welcome to Success Decoded. I'm your host, Taylor Elizabeth, an emotional intelligence and self-development coach, passionate about helping individuals uncover their true potential, build their confidence, and create meaningful success. This podcast is not just about achievements, titles, or material success. It's about exploring the deeper, often overlooked factors that contribute to extraordinary accomplishments. In each episode, I sit down with inspiring individuals from a variety of backgrounds to uncover their choices, habits, and mindsets that have shaped their journeys. Together, we explore the story behind the success, diving into resilience, emotional growth, curiosity, and other essential elements that often go unnoticed, but are crucial to living a truly fulfilled and impactful life. Get ready to decode the real keys to success, and let's embark on this enlightening conversation together. Today, we're diving into an inspirational conversation with two extraordinary guests, Dr. Nandita and her son, Dr. Rohan. They're not just pioneers in IVF and fertility treatments in India. They're also reshaped how we think about hope, resilience, and the deeply human side of medicine. In this episode, we're not just decoding success in science and technology. We're exploring the emotional intelligence, empathy, and determination it takes to bring dreams of parenthood to life. From overcoming challenges to redefining what's possible, they've built a legacy that's about so much more than medical milestones. So let's get real, get inspired, and dive into this heartfelt conversation with Dr. Nandita and Dr. Rohan.
Thank you so much, Taylor. It's really a pleasure being on your podcast. I'm looking forward to it. It's going to be a lot of fun.
Yeah, and I'm so honored that you're both here. Thank you. Said we talked about before. I love the story, and also I'm really happy to talk about this subject because this is a subject that's very close to my heart, very close to many of my family members' hearts and my friends, those that are really struggling with fertility. It's a huge topic. Really important that we're talking about it. So thank you for being here. It's wonderful. Welcome. So I will start with you, Dr. Nandita. So you've been spearheading IVF, the industry, for over 2 decades now, which looking at you, I can't believe that, but 2 decades now. What is the most significant change that you've witnessed from when you first began to where the field is?
Actually, Taylor, just to correct you, 3 decades.
3 decades.
Yes.
I can't believe it.
But there are a lot of changes. I still remember in 1990s when I began, and we were making our own pipettes. We were heating those glass pipettes on the burner, pulling them and using them, creating our own needles. I had a huge system of milky water, that is pure water, to create the melias, etc. And now, today, everything is made to order. It's ready. We just have to open packets and use it.
Yeah.
So, that is how far it has come. The medias, the consumables, everything really progressed. And along with it came a very pleasant change. The success rates at the beginning were like 10, 15, 20%. And then slowly, today, if you see, the success rate is 50 to 60%. And this is because, there have been changes in patient management. There's a lot of advance in the clinical way of handling people, treating them, getting them ready for IVF, as I call it, the pre-IVF treatment. And also the laboratory.
Yes.
The laboratory is like a spaceship today. We had artificial intelligence in our labs, I think since the past 10 years, which is now you're talking about ChatGPT, etc. So it's the technology-driven field, and it's so beautiful. I mean, you can just go sit in my lab and really enjoy being there.
Yes. No, I can only imagine. I imagine also there's been a very big shift in mindset and of acceptance as well, which is probably only boosted what you're doing because you've always loved to do it. You have faith in it. And then I'm now sure that people are recognizing how important and significant it is as well.
I think that change, there's a difference. Awareness also helped it. See, because people were not aware of it before. So they didn't know. They would go to the regular gynecologists or their family doctor who would not actually think of IVF because, the success rates weren't that good, weren't that great. But that has changed because the awareness has improved with the patients also and with the doctors also. So they also refer the patients. Now, remember one thing, that the mindset of the people, there's a different culture in India. It's not that couple only, it's the whole village. I don't even want to say family, but they are the other people who are, it's an unspoken pressure on that couple. So they also are driven by that. So I think it's a multitude of factors, and emotionally mature, I should say, yes, people are getting emotionally mature. The young couples are go-getters. They are themselves. They think for themselves. They take decisions for themselves. So I think that really does make a lot of difference.
Yeah, no, absolutely. And just talking about awareness, I'd imagine in the early years, there was some kind of stigma probably to IVF. I mean, you did talk a little bit about it here about maybe not awareness, right? There's lack of awareness. There was a stigma, at least to speak as an American or European. There's been a stigma in IVF. I mean, not even as far back as 30 years ago, even 20 years ago, even 15 years ago. I mean, there's been a huge shift in that, right? So what was the most surprising? And I don't really like focusing on the negatives, but I think it's really important to hear about your journey and what you experienced. So what is the most, I guess, memorable backlash that you encountered? And how did you help change that perspective?
Let me talk about this young couple who actually came to me. They came to me and they were doing IVF. It was a difficult case. The girl had some problems. The boy had some problems. And, they were being pressured by the family. And what happened was they had not told this to everybody because they were doing IVF. They didn't want to disclose it. And the man felt very insecure because he had a major problem. The sperm count was low. And it took a little time. By the time we had done 2 attempts and they were negative, they were completely, shattered. So I sat down with them and I said, you know what? Sometimes it takes time. If you look at a good prognosis patient, it takes 4 cycles to give a 90% live birth rate in good prognosis. That means they're young, the sperm count is good, the egg quality is good, etc., etc. Uterus is good. But in a bad patient, it's 60% over 6 attempts. So I was chatting with them. I said, you know what, your family needs to be with you because you will get a kind of a stability from them. Because what happened was they were telling them, they were giving them different doctors' names, that you're not doing anything about it. Go to this one, go to that one. All that, I said, would focus like a positive energy behind what you're doing. You need to take some people into confidence. You need to take your friends. Like the girl opened up. She said, you know what, I don't feel like going out with my group of friends because all they're talking about is their children, their classes, what nanny is doing and, that kind of thing. So that conversation depresses me. I said, you know what, you need to talk to your friends that you're going through this. That people become more sensitive. So I think this kind of awareness that it's not a disease, it's something you are struggling with and something which you want and you're working at it. So people tend to be more empathetic, more sensitive to the issue. I think this is what is required, and they actually opened up to their inner circle and they're able to deal with it much better.
Yeah. So like basically you're saying about the village giving some of the pressure, the village also can be the rescue, right? Is there a support?
Absolutely.
Really particularly memorable.
Well, there is, I wouldn't say it was one case. I would say it was one moment which actually transformed not only my career, but made me more confident. So it was actually her case,
Okay.
which I was dealing with. And she gives me a call and she's like, Rohan, I need you to do one embryo transfer where we put the baby inside the uterus. She's like, I've done the first transfer. It's a difficult transfer. I want you to try and attempt it. Maybe another hand may just be something that this patient requires. And sometimes it's just about a change of hand.
Mm-hmm.
Look, I can never compare my skill to hers. It's a landmark which I hope to achieve and go beyond. But she just said, so I went in, I did the procedure. The entire team, which is her team, was there. And they saw me do the procedure
Very smoothly.
very smoothly. Everything went easy. 14 days later, we find out the patient's pregnant.
Fantastic.
She's had multiple IVF failures in the past.
Yeah.
So at that point, the entire team realized that, okay, this guy's not just her son.
Yeah.
This guy knows what he's doing. He knows how to do it. And that actually I came to know I was more confident of my skill after that.
Mhm.
In addition, what it gave me was that, okay, now I can go and push through most of my hurdles. But I must say, whenever I do get stuck, luckily I have the boss on the phone right next to me.
Yeah, exactly.
So that always plays to an advantage. So that was one case. Another case that I want to discuss was, I had this patient, she came with 4 abortions. And this is something that it's very disturbing to the patient, because it's not the pregnancy that's troubling them. They're getting pregnant, but the pregnancy is not continuing beyond 9 months. So we did the investigations, we managed them entirely, that we knew all the pre-ART workup, what treatment was required. But just a simple thing that I did with the patient was, we put in the embryos. After that, I sat with them for just 15-20 minutes saying that, look, the procedure has gone well, everything went fine. They got pregnant. This was their 5th pregnancy. For the first 6 weeks, they would call me almost every other day. And I would just speak to them for 5-10 minutes patiently, understand that they're panicked, try to calm them down. And everything went off. For the first time, they crossed the 3-month mark, then the 6-month mark, and then they delivered. And everything went off smoothly.
Yeah.
After the delivery, they said, Doc, it was only because of your tender, loving care is what actually had. So when she talks about empathy, that's where, and this was just something that I just did it because it was like, no, I need to be for this. I need to be there for this couple. And they need that care. They need that love. So just speaking on it, I don't think I did anything extraordinary, but just something like that. And this is what they told me. They said, Doc, it was only because you sat with us every day. You answered our calls. You chatted with us. It gave us the confidence that nothing's going to go wrong. So that one case actually also made me learn that TLC,
Yes.
her terminology, but TLC, tender loving care, is something that every IVF patient requires more than anything else.
Yeah.
And those are 2 cases which actually mark my path even today, that you just have to be there for them. It actually takes away so much of the anxiety and so much of the stress.
You know, I think what you're talking about is, I mean, we know the connection between stress and in our body, and especially stress in our ability to conceive and have the embryo go into different terms and everything. We know the impact of that. I mean, you're the experts, right? So we definitely know that, but now we can really see, because as human beings, all we want to do is to be seen, to be heard, and to be valued. You know, that's the only thing. And so you did that for your patients, exactly that. And so really that carries them through, because their stress levels are lower.
Yeah.
They're more aware, they're more centered, they have more faith, they have more confidence,
Exactly.
all the energies are flowing. So that is definitely beyond probably, I wouldn't say most doctors would be doing, but it's a wonderful thing that your son, and it's a wonderful thing that you brought forward. So fantastic.
I've had good teachings.
Yeah. That's actually, we'll talk about that later. I'm really excited about Sue.
Seriously, I think a lot of couples just come and, Doc, we're just coming here because we feel good after meeting you.
Yeah.
So
Yeah, that
I
actually
mean, that
happens
is
quite a bit.
actually, I think you need to listen to them, as you said, you need to talk. In fact, we have now started this program, I think Loving Motherhood, that's what the name is, I think.
Magic motherhood.
Magic Motherhood, sorry. Magic Motherhood. So that will include all the emotional part. How to go through an IVF cycle, how to remain grounded, not to get stress, anxiety, different techniques to help you, avoid that, calm down.
Exactly. Because it's for their process of, yes, of course, keeping the embryo, keeping the baby and the process to work, but it's also their journey, right?
Yeah.
I mean, as a mother myself, I can tell you that the pregnancy journey is, even if it's naturally conceived, is fraught with worry, and especially the first time. Worry, stress.
Absolutely.
Do I eat this? Do I not eat this? Do I do this or do I not do this? And then imagine if you already have something else behind it. So yeah, it's so important, the process for the effectiveness of what you're trying to achieve, but also for their journey, as parents.
Extremely important.
Because what you're doing is giving joy, which is what we started with, right? You're giving joy and you want to continue that through. So that's a wonderful initiative to continue that with. So I'll lean into, if you don't mind now, a little bit of the empathy question.
Sure.
I will be asking some mother-son questions because we brought those up, but we'll go into some empathy questions as an emotional intelligence coach. I'm very partial to these. So this is about delivering difficult news, okay? So as doctors, you have to balance being clinical, right, which is what we were just talking about, and being compassionate, which is very much what you just showed us. So how do you handle, though, the emotional weight of delivering difficult news, for example, because I'm sure you've had to give a lot of it, especially when something is as precious as starting a family. It's joy,
I know.
And there's so much pressure, right? How do you deal with that?
It is a bit difficult. It may seem that we're doing it on a regular basis, but every patient that we do tell it to, it actually takes a bit of a toll on us as well. No, it's not just the physical toll, it's the mental toll as well.
Yeah.
So honestly, I'm just going to give an incident when we were consulting together. We just saw, we had a very heavy OPD, and the first 4 patients that the staff sends have had negative reports. And they just keep coming, and they're like, hell is happening. And it actually just took us back to we're just saying negative. See, we've sat with the patients, we've made them understand what exactly the situation is, what is the causes, all that. But it took a toll on us that everything's negative.
Mm-hmm.
What they didn't realize was, or rather we didn't realize was, there were 10 patients who were positive who were next in line.
Mm-hmm.
But the minute you put all these, so it does play stress on us that even if it's just one patient, I can't say we understand it, but we empathize with them about the fact that, look, you've gone through the entire process of IVF, you've given all your best, and unfortunately, it's still not happened. In fact, the first thing I tell my patient is that, look, my first question to you is not going to be that, did you follow my instructions? Because I know for a fact you're going to literally set alarms with pills and water in your hand, ready to take them as soon as your alarm rings. But sometimes it just happens that when everything just goes perfectly, it still doesn't stay.
Mm-hmm.
And that's where, like, as Mum was saying, that we've reached a point of 50 to 60% success rate. That's because we've got about 50 to 60% understanding.
Mm-hmm.
There's still that 40% which is unfortunately in the dark, and that communicating to them is also a difficult process, because it's not just difficult for them, it's difficult for us also to see their pain and their sadness when they go through it. So a way that I deal with it is either pick up a sport to just ease me off afterwards. Gaming, my wife hates me for that.
So could you maybe tell me a little bit more about that, Nandita?
See, with me, I think my years of experience, and probably I'm of a different generation, so I don't go for counseling. I can do it. I can internalize and deal with it myself. But yes, this actually happened, when it comes negative. So I think it's very important first to sit with the patient. First is to listen to them. I think listening is very important. And there are a lot of times when they're blaming themselves. Did it happen because I did this? Did it happen because of that? Doctor, she went to work every day. I told her to rest. Those kind of allegations start arising. So we have to sit with them and explain to them that no, that if everything is normal, you still have only a 50% pregnancy. I mean, this is something we have to communicate, because what happens is the expectations out of a cycle are too much. And we also don't like to put negativity. When we do the transfer, we say everything has gone well, everything. But that's a double-edged sword. If it's positive, it's great. But if it's negative, then the expectations which were there come crashing down.
Yeah.
So it's a difficult thing to actually balance, because I don't like to bring negativity when I've done the embryo transfer. Mm-hmm. But also at the same time, we need to keep them grounded. So yes, we tell them it's, 50 to 60% and all. So I think that communication is very, very important. Yeah. And bad news is bad news. Like, I've got a patient today where she's conceived twins, but one baby's heartbeat is gone. So, I mean, the husband was very, very upset, but the other one's doing well. So, even that sense of loss is, I mean, I understand what they're going through, But it's there. I mean, you have to deal with it. And yes, we do use therapists, as some patients do need. In fact, one of the girls who's working with me now, she said, you sent me to a psychiatrist. I mean, in our country, there are more psychiatrists. And the psychiatrist says, yes, you have all these things, but I'm going to give you a therapist so that, you don't have to start on medication because then you can't get pregnant. Right. So yes, we do combine a combination of therapy. And I think in India, the IVF specialists, actually the therapists, we learn through experience. And now the law has come and it's compulsory for therapy. And people are learning to accept it that they must just talk, otherwise the resistance was, I don't need therapy. Right. Like, I've never taken therapy myself. And as he says, maybe I need it too sometimes.
Actually, that's a really great topic. Thank you. I can imagine. I mean, can imagine the resistance. I mean, because it's a change, right? And it's to look inside of ourselves. Very difficult. Right. Very difficult. And holistically to look at ourselves, even worse. And if you're already going through this,
I think I'm very good. Why do I need therapy? That's the attitude.
That actually brings up a wonderful topic that I would love to ask on to you, Dr. Rohan. I believe that you performed quite a bit of pro bono surgeries, which is really commendable. That's absolutely wonderful and really admirable. What drives you to do this? And was there a particular story or reasoning behind it besides, I'd imagine I can't mother. Everything comes from our mother.
But let's see, she is my role model. She's my mentor. She's my teacher. And more importantly, she's my friend.
Yeah, amazing.
So this is one thing which she always used to tell me. Rohan, help people when you are in a position of power to help. So right now, since you have the ability to help out people, help them out. So when I do have patients who are really below the poverty line, they aren't able to afford their treatments and things. To a point, we've even done a few IVF cycles where we've not charged the patient anything. We may have paid out of our own pockets for their medicines and things like that. Yeah. So we do end up doing that. And this is what I learned from her, was that help, there's no harm. So it's just going to give you good karma.
Yeah.
And they're like, don't expect anything in return. Trust me, you will feel good. Like, there was this one couple which she got pregnant after 22 years of marriage.
Oh, wow.
So they got pregnant. They were non-affording. So they came to my center at DY Patil and I took care of them for 9 months. At the time of delivery, they said, Doc, just let us know what the costs are. I said, I've already decided because I'd spoken to mom that we're not charging you for the delivery. Whatever charges you have would be only your minimal charges for the medicines you may require. So we literally deliver them for something like 2,000 or 3,000 rupees. If I convert that to dollars, that's 13.
Yeah, exactly. Yeah.
So literally. So in that sense, it was just something, and the joy, the pleasure. Till date, every birthday of that child, they call me up. They take me on a video call for the cutting of that child. Yeah, it just brings a smile on my face. So it's, when I did my first pro bono and I saw this, I always make sure that I'm able to help out whoever needs it at whatever point of time.
And it's wonderful. I'm certain that you learned that from your mother. Not only because she's your mother, and I would have to say, I say this about my mother. She's my biggest inspiration. She's where everything comes from for me. As much as I love and adore my father, my mother, it comes from my mother. So I totally love that. And I would love, and we'll talk about this a little bit later, I'd love to be in the same position with you and your mother working together. That's fantastic. But also your doctors. So you have sworn to help. You have given an oath to help and to do it. And you are not only living that by being doctors, but you're living it through really helping to create life. And then in addition to that, giving like this. So that's fantastic. I mean, from a energy, from a karma, but from a mindset, it's wonderful. It's phenomenal. But a question I would ask you both, but you live incredibly busy lives. I mean, your leadership positions, your clinics, everything. How do you manage that schedule without burning out?
That's a good question. That's really a good question.
I'm waiting for the answer.
He gets burnt out more than I do, I think, because I'm in a position to delegate some of the work. All people who are around me who will do the work. No. So yes, I have to tell them to do the work. And secondly, if I have a very active social life also. So it's not only work, it's social life. And my husband's a non-medical.
Okay.
So I cannot neglect him either. And he's on a different plane only, totally different plane. So sometimes I am completely fed up or I have slept very late. So then I just take 2 hours in the afternoon off. So, fortunately, I don't work full, so I'm my own boss. So I just take 2 hours off and I recharge. I think that is very, very important. That if you know that you have worked very hard, because it tells on your behavior with your patients, tells on your behavior with your colleagues, tells on your behavior at home. So I think it's very important to be able to recognize those signs and back off. Back off. And as I said, I have a lot of people, so.
That's wonderful. Well, I mean, but delegation isn't always easy either. And there are many people that would love to know your secrets about how you delegate effectively. And we definitely talked about balancing time and setting boundaries, which is really important, all very important things. But could you give us one tip for delegating before I hear how we manage burnout? You're like, I do it.
Yeah, linearly, I was just about to spit it. I think if I have to delegate something, there are 2-3 traits which I expect from a person. One is complete loyalty. They have to be loyal to me. Otherwise, I would be insecure. Yeah. I would be insecure to delegate. Yeah. Sure. Loyalty is very important. And the second, of course, little bit intelligence. Yes. I think it's very important. And I'm a very trusting person. Sometimes my delegation does go wrong. But it's okay. I feel 90% of the people are good. 10% are crooks. And you're going to have trouble with them. And it's okay. But I don't want to, spoil things for the 90% good people. And those are the good people who help me out when I delegate and they perform. So 10% don't perform. But that's okay. That I think I've factored it in mind that this is part of the job. I will have to probably do it.
Yeah. Well, that's a great mindset. And also it's like, those are pretty good numbers. I mean, 90% is good. So if it's working, 90% is a very effective.
And she knows that those 90% are going to cover the 10%
of course.
drawback.
Of course. Of course. And you, Dr. Rohan, how do you balance this?
I'm still learning.
Okay.
I was literally thinking about how I would balance out my life. I'm somewhat similar, but I just disappear for 2 days. When I do information that, look, my phone is going to be off. I'm going to be sitting with my gaming computer. I'm just going to be playing sports. I was resting. But that happens maybe once in 3 months or something where I tell everyone, 2 days, I'm just going to be shutting off. I'm just going to be relaxing. So I'm either watching TV, I'm gaming, or I'm playing sports.
We have each other to cover for each other.
So literally this morning, I got delayed in the morning. So I made her do my procedure instead of this. Usually it's the other way around, but I that's the lucky part.
I was his assistant.
She was my assistant today and it felt good.
Yeah. So very good. I mean, you both are setting wonderful boundaries, and you're also the awareness. We talked about awareness in the very beginning. Awareness is such a huge key of any mental process, any mindset shift, any acceptance, any growth, right? But you both have great awareness of what you need, especially because you're balancing great joy and an amazing thing, but at the same time, as we talked about before, quite a bit of hard times and sadness and stress, and also, I mean, just the surgery itself is stressful. I mean, in this type of surgery, stressful.
So let me tell you a very funny thing. You should tell her about what Dada said.
No, you go ahead, please.
My 93-year-old father-in-law, we are 4 generations who lived in the same house. So my father-in-law, me and my husband, he and his wife and their daughter. So we for 4 generations lived together. So my father-in-law just passed away about 2 years ago. But he was 93 when he passed away. So he used to always, in the morning I'd be like, reading the newspaper, getting things ready, getting something, and we will be talking to him, very casual. What are we doing in the evening, doing dinner and all? And he says, you know what? You're so casual. You're going for surgery just now. That poor patient is worrying all this time. So I think, it's our defense mechanism.
Mm-hmm.
I feel it's our defense mechanism because we do that in and out, day in and day out. If we start stressing too much about the surgery or what it is, everything, I think we'll become nervous wrecks. Yeah. So we kind of, detach ourselves.
I think it's becomes an innate part of the procedure. Like, I still remember when I did my first ever surgery, I wasn't nervous. Like, obviously we get trained. But I think it was that excitement, and nervousness or stressfulness.
Yeah.
And as I started learning more and more, that's when I realized that you need to have nervous excitement. That's important. So that because every time we go in before the surgery, at least before I go in for surgery, I have my one song which has to be played before I go in. It's like when you get your mind like focused in on that.
Yeah.
So that's something that I think all of us do, but I don't think we get stressed out. It's just that it has become a innate part of us that, in fact, during the delivery, you'll see two gynecologists who are washed up having a conversation about what's for dinner tonight while we're operating.
Yeah.
Because that's our way of just making sure that we are focused. We're not worried about any of the complications. And we would just literally the way we have conversation right now, it would be during surgery as well.
Yeah, absolutely. This is a wonderful topic. I mean, it's very much what you're talking about, the nervous energy.
Yeah.
So it's there because you care about it. Obviously, you care about this. I mean, that's why you would not be doing what you're doing. You're in the wrong career if you're not saying, you don't care about it, right? And it would never have been this successful or gone this far. So you care about it. But in addition to that, a huge thing about stress management is planning and preparing and being conscious, and also finding your ways of balancing it, which may be a little bit of disassociation. But at the same time, it also is allowing yourself to be confident in what you're doing and fully present, and the preparation to support all of that. So absolutely part of it. I can only imagine. I mean, not my father's a doctor, but not coming from the medical field myself, I can imagine what that would look like and the process that you go through, which is very reassuring, I would think as well.
Yeah.
I know it's all there. But then there are times when life or the universe or God or whatever we're going to call it throws things at us. Like, for example, the COVID-19 pandemic, which I know that you are a very big part of that, and that you volunteered, if I understand correctly, to be at the front lines, which, I mean, I can't even imagine the amount of courage. I'm getting goosebumps actually thinking about the amount of courage that must have taken. I was outside of India, but just watching what was happening around the world, but what was happening specifically in India and how scary that must have been. Even if you're a doctor, even if you've given this oath, even if you are committed to that 100%, you're a human being, you're a father, you're a husband, you're a son, that must have been really, really difficult. Tell us a little bit about that.
So obviously, mom, dad, older people in our family, my granddad was also there then. So we obviously had kept them under quarantine. We weren't letting them step out, but my wife and I were still going. But we didn't know how to tell them that, look, we're going in for COVID duties, going to deliver COVID patients. My wife's working in an onco center, so she's a breast onco surgeon. So she was handling cancer patients. I was doing deliveries of COVID positive mothers. So in that way, we both had sort of hidden things from home.
Okay.
In the sense that we're not telling them at home that we're dealing with COVID patients. But at the same time, my wife and I had actually planned out that, okay, just in case any of us are COVID positive, these are protocols that are set. This is where we're going. This is what we're going to do. If I'm positive that you at the baby are going to be in one place, I'm going to stay out of the house. I'm going to be at the hospital. In case you get positive, that the baby and you will be together on this side of the house. I will shift out. And we had made like a quarantine room that not just when we were going out to see patients, but if you stepped out of the house, you come back in, you first take a shower. Oh, yes. Your clothes.
I know it was so crazy.
It was a challenging experience. It was something that I don't think the world was prepared for.
No.
But I think that era gave us a bunch of the younger generation, I would say, that boost, that confidence to understand that, okay, we can handle things now.
Because all the seniors were indoors.
Yeah.
See, that was a lot of difference to this generation because they got the confidence. They, the work was actually delegated to them and they knew they could do it. It was really life-changing for them, of course, the stress of COVID and all that. But I think India handled it well.
Amazing. No, amazing.
I think
That's why we keep saying young. After being a decade in practice, we still want to stay young as much as we can.
Well, I think we all...
today we were talking, we said 65 is young, 65 years is young.
Yeah.
That is what we were talking today.
65 is, that means that's still women. And yeah, exactly. You're not young, an embryo or an infant. Anyway, I was going to actually ask you about how that's affected your work in general, but you did that already for me. When you answered, like, it really empowered you. It empowered this next generation of of maybe leaders, of doctors or whatever, to be able to feel that they can do things because they survived something that was incredibly stressful, gave you a lot of confidence. Okay, so these are my favorite questions. You've been so gracious with me thus far, so thank you so much. But before we get into this mother and son duo, which I think is phenomenal, I will turn to my mother, who I'm sure is watching this right now, and she's my number one fan. And so, Mom, I would love for you to come work together with me, not for me, as we know that would never happen, right? But work with me because it would be my absolute joy. And I hope someday, and I'm really excited to see what my 8-year-old daughter does in her life, that we would be able to work together. That's like a dream for me. But I would love to hear about journey as mother and son. And specifically, I will ask Dr. Nandita if you could share a little bit, and I hope this isn't going to embarrass anyone, but could you share a little bit about your relationship, Dr. Rohan's childhood, a little bit about his childhood, and what was he like as a child, and how did your bond influence your work today, which I think we know pretty well?
As a child, I was studying when he was born. Okay, so I was actually living in a hostel. And he was living with my husband. They would bring my food. And for dinner would be with all of us together, but they would come with the food.
Yeah.
So initially, yes, he was brought up by my husband. And then I came into the picture, I think when you turned 4 or 5?
Yeah.
Yeah, 4 or 5, I came into the picture actually.
She got the good years.
So I got the good year. So then after that, with him, I used to drop him to school every day because my workplace was there. So I was one of the few consultants who was available, and I used to drop him to school, and we used to really have this chat on the way, and it was great. Occasionally I've forgotten he was in the car with me, and I've driven past the call because somebody called up, and so I just got distracted. So I used to say, Mama, next signal is my school, and I would be driving past it. But we've had a very fabulous relationship. I was a guilty mother, because I was working. So if he asked me, he was coming back from school, I couldn't send the car, I would give him money. He'd take a taxi, but don't, you don't need to come by bus and all. And if he asked me for 10 rupees, I would give him 100 rupees. Very bad. But, I think the culture in the house, the respect that we give our elders, being in a joint family, probably grounded him,
You should be happy about that.
I think it's wonderful, actually. I wish that I could be living with my grandparents were still alive. May God bless them. But I wish I could have been living with them. I would still live with my parents now if that was at all possible. We live in 2 different countries, so it's not. I would love for my daughter. In fact, my daughter's plan is to keep on living with us for as long as she wants. And I said, let's see how your husband feels about that, but we'll process.
It really makes a difference, I feel, having different generations while you're growing up.
Yeah.
You learn different things, different ways, and I think that makes a lot of difference.
I do think like when you're living with your family, because it's not just the parents that are raising, and I would have to say mom guilt, I totally understand that.
Yeah.
As a working mother myself,
Absolutely.
And as a working mother of choice, which is actually a question I'll ask you a little bit later, is I work of choice because I really, just like I'm sure you want to make an impact, and you feel you've been given the ability, and you feel like you've been given the skills and as women, the education to be able to do it. So you want to be able to share that, right? Especially with everyone. And you also want to be able to inspire your children. Like I want to be able to inspire my daughter, but you still have the guilt. The guilt is totally there when it's there. But I think navigating that and coming to grips with the fact that maybe it's not so much guilt as it is maybe a desire for it to be different, but at the same time, that's really missing out. The off balance of everything else that you have created for him, because of what you've done and because you have worked. It is hard. It is definitely a hard thing to navigate. You've been working alongside your mother for many years now. What's one piece of advice that she gave you when you were younger that continues to guide you in your career?
Wow. Where do I begin? Do we have another hour for this?
Yeah, I know, right? We should have started with this one. I feel like this should have been.
No, then we wouldn't have gone into any of the other questions. Well, I've already covered empathy, I've covered TLC. But one thing she said is, especially when I was in my 9th or 10th grade, she said, Rohan, do it only if you enjoy it and you're going to love it. Don't take up a field just because I'm there. Yeah. Don't take up a field just because your dad's there. Do something that you will love. So, just a simple thing that she took me to a lab they just, at that time, the video cameras were brand new. Nobody knew how to function them. Obviously, the 16-year-old knows how to function all the electronics. So she made me bunk school. She actually drove past that signal. So I'm there, I'm recording, and I'm just imagine a 16-year-old in an IVF, a science lab, and see what the hell is happening. That was bioengineering that was happening.
Yeah.
And these are the kind of labs you've only seen in movies, on cartoon shows and things like that, and you're just seeing it in real life. I come out and I said, I wanted to sit, and that's what I realized when she says, and I always used to complain to her that, you are still studying. I'm like, you've been a doctor for already years and you're still studying. Oh, yeah. I've been a doctor for 20 years. And so that, yeah, cool. I'm like, and what I realized is, you enjoy studying because you're reading about what you can do better for the patient. And that's what I realized from her, was that love what you're doing and enjoy it and be passionate about it.
Yeah.
That's first. Those are the two best pieces of advices that I got from her.
Yeah, amazing.
Mom deserved a lot. Mom deserved a lot.
No, exactly. But at the same time, I think this may be for that mom guilt that we're talking about. Oh, that should all come down to
The dad guilt.
yeah, dad guilt also. I mean, and parenting guilt. I mean, it's honestly the hardest job. We all have jobs, but it is the hardest. It's the most noble, but it's the hard.
Yeah.
But we had a mother-son date. They have a father-son date.
Yeah.
Yeah.
And father, literally yesterday was my father-daughter day.
Yes, so important.
I landed from the airport, picked up my daughter from school. She had no clue.
Yeah, so important.
Quick partying and this.
Okay, so I have two more questions. One is a little bit about your family, Dr. Nandita. So becoming from the renowned DYP family, you built an incredible legacy in your own Bloom IVF. Despite your achievements that you keep, what keeps you motivated to keep on pushing boundaries when you really actually didn't have to make this choice at all, you know? What keeps on
I think my father and mother, both of them, really inspired me. My father is amazing. I mean, at the age of 50, he changed his field. Yeah. Yes. At the age of 50, he quit politics and got into education. And look what he did. So I always think of it, age is just a number. Because some time ago, I just turned 60, by the way.
Congratulations.
Thank you. So I was telling my brother that, I'm really happy. Everything's fallen into place around. He's saying, what are you talking? Your father changed his career at 50. You can't be satisfied with what you've done. And then that really inspired me. I said, yeah, what am I talking about? I can't get complacent. And then we took on this big conference of 15,000 kind cultures.
Yeah,
but
it's a huge conference in June.
Yeah, there are a lot of ideas which are going through my mind. I think coming from this family, and father is an amazing human being, very generous. I mean, that generosity is something which I've learned from him. Very, very generous. In fact, I've seen him borrow money from a bank to lend money to his friend. If he didn't have it. So that kind of things. And I've seen the loyalty which he got because of the love that he gave everybody. And that is something which I think it's very important. It has to come from your heart. You just can't, oh, how are you? Yeah, I love you. Stuff like that. It has to come internally. And that's so important. And that's something I've learned from him.
Yeah, amazing. I think it's also, when you come from families that are a very established or very successful family, I think you always have a choice.
Yeah.
In this case, also, you always have a choice whether it's you're going to take all that you would have been given in that, and not just given as in physical things given or opportunities, but the mindset and the values, principles, and even more important, the inspiration and the drive to use that and say, you know what, this is not just, I'm going to lean on this and just kind of ride with it, but to actually make a choice and say, no, actually, I'm going to take this and grow it. I'm going to keep on developing it, which is, that's a wonderful thing to do. It also should be applauded because that's not always the choice of many. So congratulations for that as well. Okay, and my last question to you both is, can you explain the importance of empathy, emotional intelligence, and purpose-driven mindset in your field of work?
I think let him start first.
She puts me on the spot at this time. Delegation.
Okay.
Yeah. So I think that's something, empathy, if you're not empathetic, I don't think you can actually connect with your patient. And I think that's the most important thing, to understand the journey that they're going through and to be able to hold their hand and guide them through that journey.
Amazing.
Emotional quotient, my entire team, I think sometimes we get a bit too emotionally involved. Like, we would be crying and laughing with our patients. Like, my clinical assistant sometimes actually nudges me. She's like, "You're tearing up. Stop getting sad." Yeah. So in that sense, EQ is important because, look, it's not just about connecting. You want to share not just the sadness, but you want to be a part of that happiness. Every time we talk about EQ, we always talk about being empathetic, sympathetic. But you also want to be happy and joyful with that.
Yeah.
Like when you see that mother get that smile when you show her the baby, yes, it's amazing. I'm sorry, I didn't. I couldn't know the last point you said.
And the last one is a purpose-driven mindset.
I think that's extremely important. Like, look, in the morning when you wake up, my purpose is simply that make sure that every patient that walks in achieves parenthood. Besides that, I also want to make sure that if you're not purpose-driven, you don't have that mindset, you're not going to push and thrive to reach another level of success. Like, in the sense what she said so beautifully at the start. When she began practice, it was 15, 20% the success rate. Today, it's 50, 60%. My point is that why be satisfied and say that, oh, wow, we reached 50, 60%. My generation is like, oh, crap. We're only at 50, 60%. For us, our aim is we need to reach that 90%, 100% mark. I'm sure they also have that mindset, but that's what we want to. Only if you have that purpose, you're mentally driven and want to make sure that every patient that walks in gets in pregnant. That's the only way you're going to be able to achieve it.
Amazing. And you, Dr.
See, if you mentioned 3 points, right? TLC, EQ, and purpose. There's one statement which my father has told me, and it's the principle of my life. And I think that kind of takes care of the TLC and EQ. What he said was, ego is the death of life.
Yeah.
And death of ego is life.
Sure.
Once you actually start believing in it, your empathy will come, your TLC will come. I think that those two things are totally connected. When I treat a patient, I always think, if it's my child, what would I do? That's my behavior always with all my patients. If it's my sister, what would I do? That is very, very important, because then you don't, you do the right things. You take the psychological aspect of that woman. It's very important. Otherwise I'll sit like a doctor. No, you need this surgery, that is that, cut and dried. No, you cannot. You have to be one with her. You have to understand her. You have to, connect with her properly. I think that those two things, and you can only do it. Sometimes the patients tell me, "Doc, but this doctor said that." So there I should not get my ego in between. But I'm telling you this, that kind of thing. You can always, it doesn't bother me. Yeah, when people come, then I tell them why I'm thinking in my particular way. And purpose of, I think passion, focus, if you have not that, then it's no life.
Yeah.
Otherwise, what are you doing?
Yeah.
Just getting up, doing a 9-to-5 job and coming back. It's not going to give you a sense of fulfillment, a sense of achievement, a sense of happiness. I think it's very, very important.
Right. Well, if you love your work and you have joy, absolutely have purpose in your work, then you never work a day in your life, right? So I absolutely agree. Well, thank you so much for both of you. Wow, what an incredible conversation. A huge thank you to Dr. Nandita and Dr. Rohan for sharing not just their expertise, but their hearts with us today. Hearing about the way they combine cutting-edge science with compassion and emotional intelligence is a reminder of what true success looks like. We've learned that success isn't just about achieving results. It's about connection, empathy, and understanding the deeper impact of your work. Whether it's breaking new ground in IVF or simply being present for someone in their toughest moments, success is a blend of innovation and humanity. To our listeners, we hope you're walking away from this episode feeling as inspired as we are. Remember, success isn't just a destination. It's a journey that's shaped by how you show up for others and for yourself. Until next time, keep decoding success in your own unique way.